everybody, I'm Dr. Marianne Pinkston, and welcome to The Better Life with Dr. Pinkston. Today I have a treat. I have a fellow 930 The Answer, show guest, Tiffany Jones-Smith, who is heard and seen on the record with Tiffany and Kevin.
Yes.
Your husband, right?
Yes. He roped me into it.
He did. It's funny how we fall into all these matters, but the reason that this is such a pleasure and such an honor to have you on, Tiffany is widely involved with the Texas Kidney Foundation. Anything kidney.
Yes.
And kidney disease is so incredibly important, but so incredibly overlooked. Not just by, people, the general population, but by the medical community. And your involvement, first of all, you have a great story, which I want people to hear about, but you also have great involvement up to the government level. I mean, your education is every start. Please tell people who you are and why I'm so happy to have you here.
Well, I'm happy to be here, first of all, and thank you. It's an honor to be here because, I'm just a regular girl from Beaumont, Texas,
We're living large.
I'm a Texas girl. But my connection to kidney disease is that I've lost 15 family members to kidney disease when God called me to Texas Kidney Foundation, to leadership at Texas Kidney Foundation. I had lost 9. And I thought there was something genetic.
Yeah.
I thought there has to be a genetic connection here because I keep this little list of everybody in my family that we've lost and people that are still on dialysis or have some stage of kidney disease. And so at that time I was only keeping a list of the lost, and you could see the pockets of people. You could see mother, father, 4 daughters gone.
Right.
You could see father, son gone. Right. And so it was like, there has to be something to this. It couldn't be. And so when I took over the foundation, I started, there was nowhere to go but up because we had $13,000 and $11,000 in expenses against it. So after we kind of got our sea legs and got some money in the door, I got somebody to pay for me to go to the National Institute of Health's longitudinal study, biggest longitudinal study on kidney disease, because I wanted to see what is this, what's going on. I'm reading the headlines. It's $120 billion a year problem.
Right.
There are an estimated 37 million Americans with it, yet nobody knows anything about it.
That's an extraordinary number.
That's right.
That's an extraordinary, and it's not all genetic. You have a strong tie and found some amazing information on the genetic ties, and so we all think, well, it's not
genetic.
In my family. It's genetic. It's not in my family, but no,
it's not
right.
It's not. There are genetic inclusions, and there's just CKD, which is. The leading causes of CKD are diabetes, hypertension, cardiovascular disease, obesity. Well, think about that. How many Americans have diabetes?
Right.
We all know somebody with diabetes,
Absolutely.
Somebody with hypertension. So you combine the two and you really got a problem.
Absolutely.
We should be checking for kidney disease. Everybody should be getting checked for kidney disease.
And we hear about checking our cholesterol, checking our blood sugar, checking our, blood pressure, but we don't hear about checking the numbers for kidney disease, which goes along with those factors. So that needs to be inclusive in the vital sign pocket.
It should be a part of protocol.
Absolutely.
We have all of these protocols, and that's really what you guys are led by. Doctors are led by protocol.
Unfortunately, yes.
And what's sad about kidney disease is that the person that's going to get yelled at when somebody is crashing into kidney disease is the doctor.
Right.
The reality is that the doctor is as hamstringed as the patient because protocols lead what you are doing every
Absolutely.
day in your practice, and how you are addressing disease pattern and disease trajectory and what you're checking for. Because insurance is not going to pay for something that's not in the protocol.
Absolutely. Absolutely. That is just the fine, that is the absolute law right there. And that is something I fight against consistently.
Yes.
Is how protocols and algorithms are not the way that our medical system should be taxied, but it is. And that is where a lot of NPs and PAs, nurse practitioners and physician assistants now are being led into, just follow this protocol through the insurance, and it's not the way it works. And so that's where kidney disease has been forgotten now.
Yes.
Part of the reason I'm so passionate about it, and I think people have heard before, that I suffered kidney disease. It's been about 12 years or so now, and I suffered kidney disease and was almost on dialysis. I was very close to dialysis, so I took it upon myself to become an advocate for it. But it was for the simple. I have rheumatoid arthritis. Was 300 pounds at one point, and taking a crap ton of Advil because nobody would believe that I had rheumatoid arthritis, was obese and diabetic on top of that, developing some blood pressure problems, very inflamed. Inflammation is at the basis of this. So, I just went down that road that people go down, and it came to my mind that nobody caught this. I had to catch that myself, which is much of what I've had to do in my entire disease life, but catch these things myself. There was no other. I had probably 4 or 5 different physicians that could have caught something at that point,
and
they didn't. And here we are 12 years later, and guess what? They're still not catching. It's still not in the guidelines, and so it's
not.
Yeah, you find the same. I'm sure you've seen it.
Well, yes, and for every one Dr. Pinkston, there are literally 200 doctors who don't catch it, don't look for it,
Right.
don't.
Right.
There are other things, and when you talk to them, because I talk to people. Part of what we do is we educate the public about what they should be saying to their doctors, because if your doctor is not going to tell you what's going on with your kidneys, you can ask.
It's
in your blood
for yourself, and it is. So
That's right.
What are people to look for? What do they need to ask
So
for?
the first thing we tell everybody is, one, when you get your checkup and you get your blood work done, ask about a full renal panel.
Right.
Ask for a full renal panel. They're probably doing it, but just ask for it. It's a part of it.
Not. It should be.
It's something that your insurance will cover. You qualify for it. Ask for a full renal
Simple
panel.
blood test.
When you get the full renal panel, and you want a UCR, you want to get your albumin creatinine ratio done. So that's a urine test too. When you get those 2 tests, ask, what is my kidney function? And get a number, a range.
Right.
Have them tell you, because they can. It's just not something that they have to tell you. It's not, because kidney disease is diagnosed at stage 3. Once you've been at stage 3B for 3 months, well, kidney disease is detected in stages 1, 2, and 3.
Absolutely.
And it's most effectively treated in stages 1, 2, and 3.
Right.
So doctors are told, and practitioners, all practitioners are told, monitor until it gets to diagnosis time.
Right.
Well, by the time it gets to diagnosis time, you've lost a lot of kidney function.
Absolutely.
So you have to be proactive. You have to be proactive and help those practitioners, because primary care physicians, generally, their job is to understand a little bit about everything and then direct you to who you need to go to after that, a specialist of some sort. They don't all know about kidney disease.
Right.
When we're talking about this, I mean, we talk about this privately, and I'll say this publicly.
Well, I'm with you.
There are many doctors who are excellent doctors. They don't understand the kidneys. Kidneys are very complex. And not everybody gets it.
And they are, but they're not. And I think it just hasn't been a sexy,
It's not.
a sexy disease that you can throw a lot of money at and pull back to the limelight, It really isn't. And so the things that I check with patients, yes, I do just the simple, blood test for the metabolic profile. We look at your blood sugar, your kidney function, liver function, a few other things. And, that kidney function is important, and you can watch it over a decade. If I've, as a family practitioner, I'm lucky to be able to have patients that have been in my practice for a couple of decades, actually. And you can watch the trend of their creatinine and their GFR, and you can watch that trend, and it kind of ebbs and flows. But as they get a little older, as they get a little bit more overweight, as they get a little bit more inflamed, as they get more stress and less sleep and taking less care of themselves, cholesterol starts going up, blood pressure starts going up, then you start to see those two numbers start to decline. And there is a fantastic place to catch people because we have so many therapies now, whereas before we just had to watch and had to just watch it disappear. Now, one of the things that most doctors don't check, and we've talked about this a lot, is uric acid.
Uric acid.
Uric acid. Most doctors don't even check it. Uric acid is what collects in your joint whenever you see people get gout, right? And it collects in the joint, makes the joint all red, hot. You can't walk. It's very painful. You go to your doctor, get your steroid. It's over, right? No. Uric acid, if it's not in that joint, then it's in the bloodstream. And it goes through your kidney, your brain, your heart, and your blood vessels, and all the rest of your organs. And it causes that to be inflamed and red and hot all the time. But you don't feel it, you don't see it, and nobody's checking it. I can't tell you how many 30 to 40-year-old males I have sent to a nephrologist this close to dialysis. And if somebody had just checked their uric acid in their 20s, early 30s,
it would have been different.
It would have been completely different. Doctors do not check this. So look at uric acid, anything over 5.
When you brought up uric acid to me, we have a chief medical advisor, Don Wesson, and he's a writer and an editor for Janssen, the Journal of American Society of Nephrologists. I mean, he has 103 peer-reviewed papers under his belt. Like, this guy's the real deal. When I brought up uric acid, he was like, absolutely, it should be checked. Absolutely. He said that and he's done umpteen studies. I mean, really, obviously, 103 papers. He's done a lot of studies.
Absolutely.
And so I said that to say the researchers, they're seeing it, but for some reason, it's not translating over to the practitioner. And I will tell you, that is part of what we do at Texas Kidney Foundation, is that we go and find that great research that says uric acid, check this. That says and we then put it into practical use.
Right.
So what we did, and I'm so excited about this, because that research is useful. It can be used in the public, and we can stop these diseases from overtaking us. We simply have to take action. So what we did was brought an at-home screening test and coupled it with telemedicine to open up access to care. Well, we did that specifically because we were looking at 42 counties in Texas that don't have primary care physicians. We don't have primary care practitioners in 42 counties in the great state of Texas.
Does that make sense?
It makes no sense. No. So we were like, okay, let's do that. Well, when we were doing this was like 3 years ago. We did it. We got the test to the United States because we wanted to use a specific test that turned your smartphone into a clinical grade testing device, so that people could test at home. Wouldn't have to be touched. We could test them at home, and we did. And so now we have people that took that test. And we were talking to them about SGLT2Is. We were talking to them at the same time. Hey, there are therapeutics out there that are good. some of the brand names, Evocana,
Right.
Farxiga,
Right.
Jardiance. And we see the President of the United States now saying, we need to lower the prices on these things so that people can get them. But we saw that and we told them about it. So we have testimonials now from people who took that at-home test, went to their doctor with it, asked for SGLT2Is,
Right.
took them,
Yes.
and now they're off of I have one lady who's came off of 2 of her medications. Her A1Cs went down. Like her whole life.
Yeah.
Now she can have a piece of pie every now and then.
Right.
She's not like
in fear. And
yeah.
So I want people
her
to know
life changed.
Her life changed, absolutely. And I want people to know how they can do that testing and get that. So we'll have some of that information on hope. Yeah.
Yes.
So okay, I want to make sure. So I want to know how, because here I told you how fast this goes, and here we are at the last 2 minutes of this part. But how can people find you? How can people find this testing? How can we get?
Well, we have multiple forms of testing, and you can reach us at www.txkidney.org.
Simple.
Reach us. That's all you have to do is go to our website, and you can find out about our point of care testing. That's the health fairs. We go to churches, community centers. We come to where you are.
Right.
Because our goal is to make sure that you're not alone,
Right.
and that you find out as early as possible what's going on with your kidneys. And if we find something, know this. We will be there with you right on through it.
Beautiful.
The best thing about early detection is that you find it and you start taking action.
Absolutely.
You have the power to do whatever it is you believe you can do.
Absolutely.
You're not helpless in this.
Absolutely.
We can take back your health. That's right.
Absolutely. So yeah, and you can ask for that simple, a renal panel, urine and blood testing, and then you can ask for your uric acid and whatnot. So I'm going to have all of this information on my website at drpbetterlife.com. So you can also find all my previous podcasts and whatnot. And so I'm going to take just a second to say thank you to Pinnacle at pinnacleresearch.com. You can get liver testing, find out if you have fatty liver disease, which is also very rampant. Oh my gosh, we got so many diseases we got to focus on. And so, and also to Magna Pharmaceuticals, magnaweb.com, where talk a lot about MTHFR and folic acid. There's another one, big in heart disease or whatnot. We're wiping out disease. This is what we're doing. So, but you'll find all this at drpbetteroff.com. We're going to take a short break. I want to talk about those SGLT2s on the flip side. So we'll be right back.
Yeah.
Fatty liver is linked to 2 different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-529-7978 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Hello, everybody. Welcome back. I'm Dr. Marianne Pinkston here with Tiffany Jones-Smith, who is my esteemed guest today. We're talking about kidney disease, and so you are from the Kidney Foundation, president and CEO and sheer boss. I love it. I'm so glad to have you here. We have talked a little bit about diagnosing and getting, getting your kidneys checked, but talk a little bit about therapy. You mentioned right before the break SGLT2 inhibitors, and I think a lot of people don't really know what that is. It is a diabetes medicine. They have been around for more than a decade now, because I know I took one by accident. Honestly, it was I was trying to lose a little weight, get my blood pressure down a little bit, and wound up saving my kidneys. It was Invokana is what I took. And so I'm not a big medication, prescriber. I try to do things from the natural, holistic side, but there are some fantastic medicines out there, and SGLT2 medications are amazing. What's your experience with it?
Yeah. Oh, man. They are phenomenal. And I'm not a big medicine person either. I you know this. I used to weigh 340 pounds. And I say this all the time. The reason why I'm not in the same boat as the rest of my family members is that I lost 187 pounds. Now, I picked up some weight after my mother died. I picked up about 40 pounds during the pandemic. I think I told you this. I experienced losing over 70 family and friends, so I know what life is and the importance of living life, congruently with what you believe. Absolutely. Those SGLT2Is, for me, they have not just for me but for everyone. And what we've found is that they have kidney protective properties.
Very
and no one expected that.
Right.
Cardiovascular protection.
Yeah. Heart failure and heart attack prevention. So the two sides of the coin there.
And I mean, just a truckload of data that has come out telling us this.
Right.
So not only do we have cardiologists singing the praises of SGLT2Is, but also kidney specialists should be singing the praises of SGLT2Is. I mean, we can get into that discussion some other time. But they are so useful and helpful. Doctors tend to be reticent about giving praise to something, but we're 10 years in, and we know that they're really good. They're really good.
Yes, we do.
That's one of the reasons why I adore you, is because you stand up for the courage of you are the epitome of the courage of my convictions. You really stand up for what you believe in and what you know to be right, whether it is financially,
whether it's sexy or not.
Because when we're dealing with industries where there are billions of dollars being made, people tend to lean towards the thing that is the most powerful. Right. And not necessarily what is right.
And not go against the grain for what is right. I made an oath, my friend. I made an oath to save people's lives and to be there as an advocate for
and
people.
She really lives by that. She really lives by that. And we, I refer people over to her, and I'm not we're not in the business of being a referral service. That's not what we do. Right. But when somebody asks me, who do you go to as a doctor? Who do you see? Then I tell them the truth. I go to her because, one, integrative medicine is what medicine should be.
Absolutely.
It should be integrative medicine because, no, you don't need to throw therapeutics out the window. Therapeutics are useful, but they are only useful when you're using them responsibly. Yes.
Absolutely. There's a time and a place for everything. That's what I tell people about integrative medicine. You take the natural holistic side and you take the contemporary side. They both can go in opposite directions way too far either way. You take the best of both worlds and integrate them together.
Yeah.
And
hence the name.
Integrative medicine. Brilliant. And so we have talked a lot about getting your screening.
Yes.
And what to ask your doctors for, and go to your primary care. That is where it really should start. We touched on some specialists who are starting to use these meds or whatnot. We've also lightly touched on the fact that there are not a lot of renal doctors out there who test for and advocate and treat appropriately. And so go to your primary care and ask for these tests, these meds, and things like that. You are an advocate for yourself, so please do so. Where can people find you?
At txkidney.org. You can find us at txkidney.org, and we would love to hear from you. Just go on to our website. You can find us on Facebook. Just look for Texas Kidney Foundation. We will, or Google us, and we pop right up.
And you will be right there. And they can hear all about kidney disease on your show here on 930 The Answer, KLUP. And so on the record with Tiffany and Kevin, her wonderful husband, you've got, I was on there once, which was fun.
That's right.
So we did.
And we have a kidney advocate, Reginald Ballard. He is of the Martin. Yes, he was on the show Martin and on the Bernie Mac show.
Right.
And he lost his kidneys. Yeah. And received a transplant, and we're doing a lot in regards to transplantation. We have an entire push. We're premiering 2 docuseries on transplantation.
And if we could get it before people have to get to that,
that's
and we can, so we're going to catch it earlier.
We can catch it early. We can catch it early, and you can do it for free from Texas Kidney Foundation. We'll come out to your church. We'll come out to your community center. We do between 100 and 150 of these every year.
That's amazing.
So it's not just me. We actually have teams of people that go out and do this.
That's great. Well, I'm going to make sure that all this information can be found on my site as well. So drpbetterlife.com. And again, you can find all the places where you can find Tiffany here. You can find Texas Kidney Foundation. You can find more information on other diseases and some of the blogs and podcasts and things like that I've done. Almost 200 now. I think.
Wow!
I know.
We need to have a party or something for that.
We're going to celebrate. We're going to get Shemai. We're going to party. So we will drpbetterlife.com. Please look, and thank you to my sponsors. Thank you for being on. I appreciate it so much. We'll have to do this again. Talk a little further. It's such a short 30 minutes.
Love
but
it.
I appreciate you so much.
Thank you for having me.
Absolutely. And so everybody, I hope you have a fantastic week out there. Thank you.